Hello and welcome to our latest video on baby's first food. Are you excited to learn about the introduction to solid foods for your little one? Introducing solid foods is a significant event in a baby's life and is usually marked by the transition from exclusively breast milk or formula to a more varied diet that includes solid foods. However, for first-time parents, this can be a nerve-wracking experience as they want to make sure that their baby's first food experience is enjoyable and nutritionally balanced. The process of transitioning to solid foods typically begins when a baby reaches 6 months of age and is developmentally ready. It's important to remember that babies' digestive systems are not yet fully mature and are still developing, so they may not be able to tolerate certain foods or textures. To make the transition as smooth as possible, it's recommended to start with simple, pureed foods and gradually move on to more textured and flavorful foods. Vegetables and fruits are often the first foods introduced, but over time, a variety of grains, meats, and dairy products can be added to the diet. It's also essential to pay attention to your baby's hunger and fullness cues and avoid overfeeding. Babies may not eat a lot of food initially, but that's okay as they will gradually increase their intake over time. It's also essential to keep in mind that babies may not like certain foods the first time they try them, so persistence and patience are key. At every step of the way, it's crucial to ensure that your baby is receiving a balanced diet that provides all the essential nutrients for growth and development. A pediatrician or registered dietitian can provide guidance on what foods to offer and how much to feed your baby. In conclusion, introducing solid foods is an exciting time for both baby and parents, but it's important to approach it with care and guidance to ensure that it's a positive experience. With the right approach, you can help your baby develop a love for healthy and nutritious food that will serve them well for a lifetime. So when is the right time to start introducing solid foods to your baby? The American Academy of Pediatrics (AAP) recommends that most babies be introduced to solid foods between 4 to 6 months of age. This is typically the age when babies have developed the ability to sit upright, have increased control of their head and neck, and have lost their tooth thrust reflex, which pushes food out of their mouths. However, it's important to keep in mind that every baby develops at their own pace, and there is no one-size-fits-all approach to solid food introduction. While the AAP recommends that babies be introduced to solid foods at 4 to 6 months, there are some babies who may not be ready until they are closer to 6 months old. On the other hand, there may be some babies who are ready for solid foods as early as 4 months. This is why it's crucial to talk to your pediatrician about when your baby is ready. Your pediatrician can help you determine if your baby is ready by observing their physical and developmental milestones and taking into consideration any underlying medical conditions or feeding difficulties. It's also important to remember that solid food introduction is a gradual process. Babies should start with small amounts of single-ingredient foods, such as rice cereal or pureed fruits or vegetables, and gradually increase the quantity and variety of foods over time. Introducing solid foods too soon or too quickly can lead to choking or digestive problems, as well as interfere with the development of healthy eating habits. In conclusion, while the American Academy of Pediatrics recommends that most babies be introduced to solid foods between 4 to 6 months, it's crucial to consult with your pediatrician and follow their guidance on when your baby is ready. Every baby is different, and a personalized approach to solid food introduction is key to ensuring a smooth and healthy transition for your little one. Host: So, what are some signs that your baby is ready for solid foods? Some common signs that your baby is ready for solid foods include: they can sit up with support, they have good head control, they are showing interest in food and reaching for your plate, they can open their mouth when a spoon comes towards them, they no longer push food out of their mouth with their tongue. So, what kind of foods should you start with? Starting solid foods is an exciting milestone for both parents and babies. However, it is important to introduce solid foods in a way that is safe and easy for your baby's digestive system. The best way to start is by introducing single-ingredient foods that are easy to digest. These foods should be pureed to ensure that they are soft enough for your baby's delicate digestive system. Fruits and vegetables are an excellent choice for your baby's first solid foods. They are packed with essential nutrients and vitamins, making them an ideal choice for your baby's growing body. Some popular options include pureed apples, pears, carrots, and sweet potatoes. These fruits and vegetables are easy to digest and are a good source of fiber, which helps to keep your baby's digestive system healthy. Cereals are also a good option for starting solid foods. Rice cereal is a common choice for many parents, as it is easy to digest and does not cause any digestive discomfort for most babies. You can also try other types of cereals, such as oatmeal, barley, and quinoa, which offer a different texture and flavor for your baby to explore. Pureed meats, like chicken and turkey, are also a great source of protein for your baby. These meats should be introduced gradually, starting with small amounts and gradually increasing as your baby's digestive system adapts. They are an excellent source of iron and help to support your baby's growth and development. However, it's important to avoid foods that are high in sugar and salt. These foods can disrupt your baby's delicate digestive system and can cause discomfort and other health problems in the long run. Instead, try to focus on providing your baby with healthy, whole foods that are easy to digest and packed with essential nutrients. This will ensure that your baby is getting the best start to their solid food journey. How should you introduce solid foods to your baby? Introducing solid foods to your baby is a process that should be done gradually. Here are some tips. Start with small amounts, just a teaspoon or two, and gradually increase as your baby becomes more comfortable. Offer one new food at a time, so you can easily identify any food allergies or sensitivities. Offer solid foods at meal times, not as a snack. Offer a variety of different textures and flavors to help develop your baby's palate. Offer foods in a variety of forms, like purees, mashed, or soft finger foods. Transition back to host. And lastly, what should you avoid when introducing solid foods to your baby? When introducing solid foods to your baby for the first time, it is essential to create a positive experience for them. One of the crucial things to keep in mind is to avoid certain foods that can be harmful to babies. Honey should be avoided as it can contain bacteria called Clostridium botulinum, which can cause food poisoning in infants. This bacteria can lead to serious health problems, including botulism, a life-threatening illness. Therefore, it is essential to wait until the baby is at least 12 months old before giving them honey. Another important factor to consider is choking hazards. Foods like nuts, popcorn, and hard candy can pose a choking risk to babies. These types of foods can get stuck in the baby's throat and cause them to choke. Therefore, it is best to avoid these foods until the baby is old enough to eat them safely. Additionally, it is essential to limit the amount of added sugar and salt in your baby's diet. Excessive intake of these substances can lead to health problems such as obesity and high blood pressure. Therefore, it is best to avoid processed and packaged foods and choose fresh, whole foods instead. Lastly, whole grapes and cherry tomatoes can also be dangerous for babies. These foods are too large for the baby to chew and swallow properly, which can lead to choking. It is recommended to cut these foods into smaller pieces before giving them to the baby. In conclusion, to ensure that your baby's first food experience is a positive one, it is essential to avoid foods that can be harmful, such as honey, choking hazards, added sugar and salt, and whole grapes and cherry tomatoes. By doing so, you can provide your baby with a healthy and enjoyable experience as they transition to solid foods.